Good afternoon, everyone. My name is Lucas Ranzoni, and I'm very pleased to bring this presentation for you all. Today, I will present the project name Increased Cytokine Levels and Histological Changes in Cartilage, Synovial Cells, and Synovial Fluid after Malleolar Fractures. I want to thank you all the support of Arthroplasty team and my colleagues Alexandre Godoy and Valci Teodoro, who made this happen so far. Here we go. So there are no conflict of interest on this presentation. So let's introduce. 1 in 800 people suffers an ankle fracture every year, and of all ankle fractures, 52% occur in men. With increasing aging, elderly women are affected too. And despite advances in fracture management, the overall risk of developing post-traumatic osteoarthritis after 10 years is almost 40%, particularly with bimalleolar type B and C of Weber classification or fractures involving the posterior tibial ring. There are negative prognostic factors that have been identified in the treatment of ankle fractures. And they are articular incongruity and increased pressure on the chondral tissue, residual joint instability, and especially syndesmotic, and the acute inflammatory changes in the ankle joint. Besides, the most important factor is the damage caused by the acute injury to the articular cartilage, which may lead to joint degeneration despite an accurate and anatomical reduction. And here we can see the current treatment for unstable malleolar fractures, that is open reduction and anatomical internal fixation, focused on avoiding those negative prognostic factors by restoring the articular surface congruence and ankle stability. However, the acute inflammatory changes in the chondral tissue, synovial tissue, and synovial fluid cannot be modified by surgery. Like you see here on those two articles, chondrocytes have a limited ability to recover from injury and can be damaged to almost 35% of death or apoptosis in the trauma. Also, the local inflammatory response from synovial tissue and synovial fluid contribute to the development of osteoarthritis. Increased numbers of collagen and protoglycan fragments in cartilage and synovia have been described as biological markers of cartilage damage. And increased concentrations of several pro-inflammatory cytokines have been found in the synovial fluid, but we still are not aware of any study showing the simultaneous changes at the different articular tissues in the same specimens. So in this study, we hypothesized that in an acute phase following ankle fractures, an increased concentration of specific pro-inflammatory cytokines, increased protoglycan and collagen debris, and histological evidence of chondrocyte damage may be observed at the same time. So the aim of the study was to analyze the morphological changes within the chondral and synovial tissue and the concentration of cytokines in the synovial fluid of patients in the acute phase following malleolar fracture. The samples were divided in two groups, and the study group consisted of 16 patients, 10 male and 6 female, diagnosed with an acute unstable malleolar fracture between September 2010 and August 2011. The mean time between trauma and surgery was 3 days, in a range 2 to 5 days. And the average age of the patients in the study group was 35.94 years, in a range 24 to 48 years. 12 patients presented with a malleolar fracture type AO44B and 4 patients with 44C. Routine radiographs and MRI was obtained for all patients in the study group, and samples of the synovial fluid, and articular tissues were obtained during standard open reduction and internal fixation. The inclusion criteria for the study group were aged between 24 and 48 years old, presenting an acute ankle fracture at emergency department, a closed malleolar fracture Weber type B or C, and an MRI showing contusional injury of the articular cartilage associated with edema of the subchondral bone on the lateral talar dome. The control group consisted of 5 male fresh frozen cadavers, ankle obtained within 12 hours of death over the same time period. The average age of the samples in the control group at the time of death was 42 years, and the inclusion criteria for the control group were male fresh cadavers at University Death Verification Service, and no record or medical history of foot and ankle injuries, no infection, immunological disorders, or rheumatic disease. The collected tissues were stained with hematoxylin and eosin to access the structure of the tissue and characterize the cells under an optical microscope. To measure the collagen content of the tissue by light microscopy and polarization microscopy, the samples were stained with picrocereus prepared from cereus red in saturated picric acid solution. Staining with PIS Austrian blue was used for analysis of protoglycans in synovial tissue, and safranino-fast green was used to quantify those protoglycans. Immunofluorescence reaction was prepared for analyze the collagen type 1, 3, and 5 in synovial tissue, and analysis of cytokines in synovial fluid were prepared for IL-2, 6, 10, and 17, interferon and TGF-beta-1, who were determined using commercial kits counterparts by ELISA tests. And the analysis of the chondral tissue was most descriptive, and the findings in the synovial tissue and cytokines within the synovial fluid were analyzed with unparity test. We used a p-value less than 0.05 to consider statistically significance. So here, as results, we show first the hematoxylin eosin of the cartilage, and the morphological analysis of the chondral tissue specimens in the study group here showed discontinuity of the tight mark between cartilage and bone. Furthermore, there was disarray of the chondrocytes here and increased cellularity in both the cartilage zones and subchondral bone in the control group displayed in contrast, the specimens in the control group displayed a well delineated here tie mark, an organized cell array, and a smooth articular surface. The staining of safranino-fast green revealed the position of protoglycans in the study group specimens, as shown by a more pronounced blue safranin staining. Disintegration, again, of the tide mark, and remodeling of the subchondral bone. In contrast, in the control group, they appear normal. Evaluation of the synovial tissue in the study group specimens indicate the presence of synovitis, which has characterized by intense inflammation of the subsynovial tissue, obliteration of vessels here in the black arrow, and replacement of the fat tissue by fibrous tissue. Like we see here, we have a good fat tissue, and here most of the tissue is fibrotic. Both of the changes in the synovial membrane and in the subsynovial tissue. In contrast, The control group specimens displayed a normal synovial tissue with a thin synovial membrane and a fatty subsynovial tissue. Here we can see a sample of the study group with intense synovitis and the obliteration of a vessel marked here with the black arrow. And we can also see that there is almost no more fatty tissue replaced by fibrotic tissue. And additionally, there were deposits of basic and acid proteoglycans. Basic is stained in red and acid proteoglycans in blue, as shown here by PIS Elsham blue staining, both in the subsynovial tissue and the synovial membrane of the study group specimens. We can see in the pictures here a very thickened synovial membrane with a fibrotic aspect and strongly stained by the presence of those proteoglycans. Similarly, we could see a marked deposition of collagen fibers as shown by orange-red picrocereus stain under polarized light, once again indicating a fibrosis process in the vessels of the subsynovial tissue and the synovial membrane. The marked collagen and proteoglycan accumulation in the synovial tissue here of the study group contrasted with a faint expression of both proteoglycans and collagen in the synovial tissue of the control group. Specimens of the study group here in a wider view showed a marked deposition of collagen fibers by an intense red-orange birefringence, indicating a fibrosis process in the vessels of the subsynovial tissue and the synovial membrane. Actually, statistical analysis of the synovial tissue specimens staining by picrocereus red also revealed a statistically significant difference between the study group and the control group in concentration per area of both thin collagen fibers and thick collagen fibers, showing a disarrangement of the synovial collagen. In agreement with the increase of the collagen in different compartments of the synovial tissue, we also observed in the immunohistochemical staining an intense type 1 collagen expression in the study group, both in the synovial membrane and the subsynovial layer. Collagen type 3 was detected in the subsynovial tissue, especially around the vessels. And intense deposition of collagen type 5 was found in the synovial tissue, which indicates a fibrotic process in the specimens of the study group compared with those of the control group. We also observed a thickening of the type 5 collagen fibers in the specimens of the study group that was not seen in the synovial tissue of the control group specimens. Finally, the evaluation of cytokines in the synovial fluid would reveal statistically significant differences in the concentrations of IL-2, 6, 10, and 17, and no statistically significant difference were observed in interferon and TGF. For discussion, we observed that osteoarthritis of the ankle affects 1 to 4% of adult population, and 78% of cases are estimated to be of post-traumatic origin. Fractures around the ankle are responsible for even 62% of the cases, and individuals with post-traumatic osteoarthritis at the ankle tend to be younger, with joint degeneration in the lower limbs, and present faster functional loss, with progression to the final stages at the disease between 10 and 20 years after the initial event. The acute ankle injury initiates a sequence of events at the cartilage, synovial tissue, and synovial fluid that may potentially lead to progressive damage to the articular surface. We hypothesized that in the acute phase of an ankle fracture, an increased concentration of pro-inflammatory cytokines, dysregulation of proteoglycan, and collagen remodeling and direct chondrocyte damage may play an important role in the pathogenesis of post-traumatic osteoarthritis. We observed the interactions among the different tissues during the acute phase of an ankle fracture, showing the whole articular environment at once. On synovia, our findings indicate the presence of synovitis as characterized by intense inflammation, obliteration of vessels, and replacement of the fat layer by fibrous tissue. It is further confirmed by immunofluorescence with collagen and protoglycan accumulation, both in the synovial membrane and the subsynovial tissue, which was significantly increased compared to the control group. Furthermore, recent studies of intra-articular cytokine levels following acute articular injury have shown the maintenance of an articular environment that may potentially perpetuate the cartilage catabolism. Limitations of the study include the relatively low number of patients included, but however, the study group is a representative of the target population and shows a demographic homogeneity. Additionally, we included a control group to analyze all the variables studied. The observed difference between the groups regarding changes in chondral tissue, synovial tissue, and cytokine levels were statistically significant, which indicates a reliable soundness of the data. As this study has cross-sectional character, it is not possible to determine a definitive cause and effect relationship. Plus, the fact that the osteoarthritis is a spectral disease with varied clinical and radiological presentations, it's an important limitation for the study too. However, it's well known that the observed events and morphological changes may lead to progressive articular surface damage, resulting in post-traumatic OA. And another limitation of the study is the missing genetic analysis of the specimens. So the present study shows for the first time the acute damage that happens simultaneously to different articular tissues following fracture. These inflammatory changes that occur in the time of trauma may initiate a sequence of events that potentially lead to progressive damage of the articular surface. Through the knowledge of these events may enable the evaluation of therapeutic strategies to prevent or delay the development of post-traumatic osteoarthritis in the future studies. I would like to thank you for the opportunity to share these finds, and I am at your disposal for any doubts or questions. I also leave here my mail and Instagram, and feel free to get in touch if you want.